So first of all, I'm really sorry to hear you've been suffering so much, and also I'm not a doctor, so this cannot be construed as medical advice, but I might be able to point you in some directions that you can look into or discuss with your doctor. The first thing I would wonder is if the redness and the worsening seems to be related to putting on the vaginal estrogen cream. A lot of the creams, the commercially available, so not custom compounded estrogen creams, contain propylene glycol, which is a common and well-known skin irritant, contact dermatitis causing agent. I've made a lot of videos on this. Sometimes people with sensitive skin are also sensitive to methyl and propylparaben, which are put in common prescription pharmaceutical topical creams. So one thing you could try, especially because of your age, your doctor thinking you may be suffering from hormonal atrophy, is a compounded version of estrogen cream. So what you want to do is go to a compounding pharmacy, ask to see the ingredients list of the bases that they use, the cream and ointment bases that they use for hormone replacement therapy products, and then you would ask for a small sample of that, and you would try it on your skin, maybe on your arm, and see if you have a reaction. Also try it on your vulva or vaginal skin and see if you have a reaction. If that cream does not make you feel worse, then you could try ordering the hormone estradiol, which is estrogen, in that cream. Or you could go through all the different commercially available with a prescription or from a regular pharmacy like CVS, those types of vaginal estrogen replacement products. Find one with the least amount of known irritating ingredients. I use ingredients checkers to look up, and I also search ingredients in like PubMed.gov to make sure to see if there's incidences of dermatitis and irritation with specific ingredients. I also just use the Clean at Sephora list. Sephora has a list of chemical irritants that are kind of well known or suspected or banned in other countries. So that's just thing one, that the estrogen cream is often, I see this a lot. I've actually had women tell me that I saved them because that was their problem. But that's definitely not the only problem or everyone's problem. The problem being that the hormone cream that should be helping your vulvodynia is actually making you worse because it contains irritating ingredients. Another thing could be that you might need testosterone replacement as well. The entire female urogenital tract, as well as the entire female body, as well as everyone's bodies, also needs testosterone. And a lot of the medications we're prescribed suppress testosterone, and aging, of course, all humans, their testosterone levels plummet. For example, in the vulva, in the vestibule, there are glands, the Bartholin's and the Skene's glands, that are testosterone dependent. They produce protective and lubricating fluid. They need testosterone to do that. So that can be a contributing factor into people's vulvodynia. But since you're also saying that this started when you were 16, I don't know if maybe you were put on the pill at that time like I was, but there's other kinds of vulvodynia, unfortunately, that are not related to hormonal atrophy. And a lot of gynecologists and even urogyns are still completely clueless. But looking up the vulvodynia treatment algorithm can give you, and hopefully an open-minded doctor, a place to start looking at the other causes. One cause of people who seem to have noticed maybe that they started vulvodynia having it at 16. I mean, for me, I didn't notice until I tried to put a tampon in for the first time. But a lot of us have something called neuroproliferative vestibulodynia. So the pain is localized to a specific ring of tissue at the vaginal entrance called the vestibule, which is a distinct embryological tissue from the skin of the vulva, the labia, etc., and the internal skin, the vagina. This vestibule skin is actually similar to the skin, it's the same as the cells that developed into the urethra and the bladder. This skin can be rich in mast cells, and in some people, way too many nerve endings develop. We're not quite sure how and why that is always happening. It seems like there could be a congenital. Some people are just born this way, and some people develop neuroproliferation. So a development of way too many excess nerve endings, creating hypersensitivity after infections or insults to the skin, allergic reactions. So that's something else to look into. The treatment options for that are not great. The main one is actually getting that specific tissue surgically removed in a surgery called a vestibulectomy. So to really understand your options and to get to the bottom of this, especially since you've been dealing with it for such a long time, it's likely that there's a lot of things going on. For most of us, it takes years. By the time we start getting treatment, we have also developed pelvic floor muscle dysfunction. other problems, and you really need to see a doctor called a vulvovaginal specialist, usually a urologist or a gynecologist who has specialized in vulvovaginal pain conditions. Another kind of doctor or another label that would be a green light for someone who's going to believe you and be up on like the most recent information on treatments for vulvar pain is going to be someone calling themselves a sexual medicine expert or doctor. And really, that's just pertaining to illnesses of the sexual organs. Anyhow, hope this helped. And if you want some more resources on my Instagram version of this account, I have links to the treatment algorithm, to my other videos. I have like them categorized by topic, and the same thing on my YouTube channel, where I'm also able to put links to websites and academic medical journal articles that are kind of backing up what I'm saying. I really hope you can find some answers, because it's not normal to be burning and red and swollen. Even when you have provoked vestibulodynia, to be red and swollen, that's something that deserves direct and targeted and real physiological, biomedical treatment. It's not in your head. There's something causing it, and you deserve to get better.